I'd like to give a report on Kyle Berry. The situation is Kyle Berry is a 9-year-old patient who was admitted to your Peds med-surg floor. He is status post-appendectomy for a ruptured appendix. He's currently experiencing pain and is hypovolemic. His estimated blood loss from the OR is 300 milliliters. He has a JP drain present on his right lower quadrant. His post-op labs were sent upon arrival to the unit, and it was a BMP and a CMC that were sent. His background is that he was seen in the ED late last night for sudden pain in the middle of his abdomen. It was concentrated around the belly button with nausea, vomiting, fever, and diarrhea. At first the pain came and went, however it became persistent and sharp, which was when they brought him to the emergency department. Kyle was moved from the ED to the OR for an emergent removal of his appendix. My assessment showed that he has just returned to your floor from the PACU status post-appendectomy for a ruptured appendix. He has a 21 gauge IV which is saline locked in his right forearm. Admission orders have been written. He is currently experiencing pain and is hypovolemic. He does still have the JP drain present on the right lower quadrant with the dressing on that right lower quadrant from the JP drain, which is draining sanguineous drainage. His eyes and nose have included IV fluids for intake of 75 cc's of normal saline, and his output came from 3 different sources. The Foley put out 75 cc's, the JP drain put out 5 cc's, and as I said before, the estimated blood loss from the OR was 300 cc's. The recommendation is that the surgeon is very concerned about the development of peritonitis. Please watch the patient closely for signs and symptoms of peritonitis and sepsis.